My back pain started around about 10 years ago following a road traffic accident. I was admitted to hospital on the Hartlepool site and gradually my back pain became more and more severe. I had treatment on the North Tees site from one of my consultant colleagues and that's consisted of a percutaneous discectomy. That helped my back pain for, I guess, around about 6 months and gradually the timescale between having back pain and leg pain, and it was predominantly leg pain that caused the discomfort. They were gradually becoming shorter and shorter, and the periods of rehabilitation were becoming longer. And as a result of that, I had a number of treatments which involved facet joint injections and also epidural injections for pain management. It would be approximately 6 years ago now that I met Mr. Krishna and we talked about my back pain and he agreed to look after me. Generally on a day-to-day basis I would be taking quite a number of painkillers to help me get through the day at work. That would consist of getting up early in the morning and having to take analgesia to get moving, to get into the shower, and to physically get into the car would often pose some difficulty. Occasionally during the day, I have to say, I would probably feel quite sleepy as a result of the amount of painkillers I was taking. I would get home from work and then I would end up taking more painkillers and often going to bed quite early on an evening, and that would allow me to manage my pain and allow me to continue to be at work. Very rarely did I end up losing work because of back pain, and I generally managed my work life around my social life. So it was really my social life that was affected by the back pain. Weekends would be spent not doing an awful lot and certainly not being involved in any sporting activities, and I'd previously played squash in the past. Having consulted with Mr. Krishna and had a number of consultations with him, he agreed to undertake a PLIF, a posterior lumbar interbody fusion. And at that time he did advise me of the complications related to that surgery and also the risks associated with spinal surgery and of course the general risks relating to an anaesthetic. And I felt as though I was making an informed decision to go ahead with the surgery predominantly because of the effect it was having on my life, and as I say, the period of rehabilitation was becoming much longer. I would have problems with a drop foot, I would have problems catching my foot against the floor as I was walking, and occasionally my knee would give way, and I felt that the quality of my life was decreasing month on month. So when the decision, or when Mr. Krishna offered surgery, the decision I think was quite easily taken to proceed with it, acknowledging the risks that were associated. I was admitted to hospital on the day of surgery and really remember very little around the actual day of surgery at all, other than waking up in the high dependency unit of the hospital with an epidural in place. The morning after, I was transferred back to an orthopaedic ward, but I could tell immediately that the leg pain had gone. Yes, there was pain in my back, which was associated with the surgery itself. And I recall probably mid-morning Mr. Krishna coming round and visiting and saying, right, let's get you up and we'll take you for a walk up the ward. And I'm probably quite shocked at this, thinking, well, no, I've had spinal surgery, I'll be laying in bed for 2 or 3 days. And I was sadly mistaken because he did make me walk up the ward. And I have to say, following that, I wanted to sit in the chair for a short period of time. And it was only a short period of time, but certainly felt much better and realised then that the back pain that I had known for some considerable years had actually gone, and that the pain I was feeling was predominantly just from the operation site. I was discharged from hospital around about 48 hours after surgery, between 48 and 72 hours after surgery, and I took some paracetamol, which were really for relief of pain around the operation site, for a further 2 days. And after that, I've not taken any pain relief for back pain since that time. Certainly my social life has improved dramatically. my work life has improved because obviously at the present time I don't take any pain relief and therefore I don't feel drowsy associated with the pain relief. So for me, the surgery did work. I don't suffer with back pain in the way I did previously. Obviously, if I go digging the garden or moving things around, then yes, I will get the aches and pains, which are, so I feel, more of a muscular nature, certainly not the nature that they were in the past. So for me, surgery did work, and I know Mr. Krishna's asked me in the past to speak to patients, and I'm always positive around what it's done for me, and I recognise that everybody's an individual. I was motivated to convalesce quite quickly, and certainly with the support of colleagues at work, I was able to get back to work around about 6 weeks after surgery, and I've really continued to improve since. To such an extent that today I could play squash again. I certainly go jogging. I go to the gym probably once or twice a week, and I think my general motivation has improved as a result of that.